going through a pelvic floor stretch or lengthening exercises. So I just have my model here. This is your pelvis and spine, the base of your spine. So you can see how the pelvis wraps around to your pubic bone. And then on the bottom, you have your two sits bones that you sit on or forward of. So I'm just going to turn this so you can see all of this in red right here are trying to show and demonstrate different pelvic floor muscles, but in general, this is the pelvic floor that we talk about. And it's kind of in a diamond shape. So it goes from the pubic bone out to the sides, to the sits bones, and then back towards the tailbone. So we often talk about it in terms of being in the shape of a diamond, and also it's like a dome, so like a hammock. That being said, I'm just showing you this because when we're doing something to lengthen it, a deep squatting position and our legs out to the sides is what helps that diamond lengthen and get bigger, okay? Because your sits bones are widening, and that's what's helping those muscles elongate and stretch. So this is a modified deep squat. It's supported, so you can really just be in that posture for some time and just focus on your breath. This is a yoga block. You can use different things. Maybe you have a low stool, something obviously that's stable and it's not going to move. And what you can do, you would adjust based on what you feel like is supportive but effective for you. So I'm going to start with this just right here. And I like to have my hands here. You could also have them here on the floor. That's fine. My arms are just supporting my legs, so they're out to the sides, and I'm keeping my back up nice and tall. I like this. It just feels nice to kind of have my elbows there and my hands just folded nicely over my chest. And I'm just here and I'm just breathing. You're just inhaling, allowing that air to fill your belly, to fill into your back, into your rib cage, into the pelvis, into the pelvic floor. And then you're exhaling and letting the air mount. You could also, if you want it a little deeper, you can have it be here. You want to be cognizant of where you're allowing your body to make contact with the surface you're using. Sometimes if I'm too much on the surface, it's putting too much pressure on my pelvic floor muscles, and it doesn't really feel good. I almost feel like I'm like trying to protect myself. So just be cognizant that your surface isn't causing you to tense up or tighten. So once we're here, you're just breathing. Maybe you take 5 breaths here. Maybe you go for a full 30 seconds. And trying different things. If you'd like to have your hands down on your ankles. But again, you really want to have your chest up and support those legs so they can just relax and stay outward.